Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone, and welcome back to Straight Outta Health IT. I'm your host, Christopher Cunny. I'm excited again to have on my program another thought leader in our industry. And this time we're going to talk about how health plans are starting to drive technology disruption in our industry. And I have, for my guest, one of the experts in this space, Unmesh Srivastava. And let me give you a little bit of background about Unmesh's background in this industry. Unmesh Srivastava has dedicated 15 years of his professional career to value-based healthcare through technology, innovation, data enablement, business intelligence, artificial intelligence, and digital transformation of payer and provider business operations. He has been instrumental in managed care space in both startup and publicly traded companies. He serves as the Chief Technology and Digital Innovation Officer at Clever Health Plan, where he leads everything from data technology to analytics and data enablement. Prior to that, he served as CTO at P3 Health Partners, and he led the technology enablement efforts at that organization. He's also led innovation and business transformation for organizations such as Optum Care in California, and has consulted for enterprises such as Kaiser Permanente, Toyota, and Verizon. He has a BS in electronics and communication engineering from Rajasthan University in India, a master's in engineering management from Cal State Northridge, and numerous executive certifications in management, AI, finance, entrepreneurship from Wharton, MIT, and Harvard Business Schools. Wow, talk about a background, an impressive background, and I'm so glad to have Unmesh on the program. So welcome, Unmesh. It's a pleasure to have you on Straight Outta Health IT today. And before we begin, I always like to ask my guests to share a little bit about their journey. How did you get to where you are today in helping to drive transformation in this space, specifically in the health plan space? And talk a little bit about that journey for our audience.
Absolutely. And thanks for having me on your podcast, Chris. Very excited that we are having this conversation. In terms of my background, I mean, I'm a first generation immigrant in US. I was born and raised in India, New Delhi, did my undergrad from India, and then came over to US for my master's. Interestingly, everyone in my family, I've got a family of doctors. So my mom is a doctor, my grandfather was one, multiple people in the family are physicians and surgeons and so forth. So I've seen, while growing up, I've seen like healthcare, care delivery very closely. So my plan was that, hey, I don't think I'm built for that. I'll probably go pursue engineering.
Exactly.
So I pursued engineering, and here I am back in healthcare and doing great things from the engineering and tech side in healthcare.
That's
so yeah,
great.
I mean, I didn't ever imagine I'm going to come back to healthcare, but when I came to US and started working for organizations like Kaiser, United, it dawned on me like, there's just so much to be done from a tech enablement perspective, and I kept continuing my work in Medicare Advantage space and value-based care and tech enablement of the care delivery and general healthcare ecosystem.
That's great. It's so funny. I think about my own experience. So I grew up in a family of teachers. My grandmother was a teacher and a principal. My dad was a teacher. My sister was a teacher. And I said for the longest, I'd never go into teaching because I saw all of that growing up and the challenges that they had. And lo and behold, years later, I'm now serving as an adjunct professor at a couple of different universities as well. So I guess sometimes if it's in your DNA, you're just destined to be a part of the industry in some form or fashion. So I can appreciate your journey in healthcare as well. So let's jump right into this because time will fly by before we know it. I do want to talk about this disruption that's happening in healthcare. And I was reading a recent report from Gartner about health plans, and it said, in order for health plans to stay competitive as we move towards more of a customer-centric future, it means that these health plans must effectively deliver seamless, personalized, and a secure experience that exceeds customer expectations. Now, health care organizations will no longer get a pass simply because it's complicated. They should live up to the same standards as other industries. A better customer experience can be built on the foundation of transparency, interoperability, and trust. And the word goes on to say that within these health plans, there has to be a consideration and adoption of technology. In order for them to succeed, they must recognize they need to transform their business from managing enrollment and pooling risk to taking care of the members' health and well-being for their entire lifetime. And I know you are working with an organization that's truly transformational, Clever Care. And I was wondering if you could maybe talk a little bit about how your organization is approaching this new model of care differently from the traditional health plans.
Yeah, no, that's the most relevant thing. And if you see all the organizations and experience you are interacting with on a day-to-day basis, whether it be taking your transportation, you work with, you got Uber and Lyft. It's a one-click experience, very personalized to what you want. You go to Amazon or any of the sites where you do online shopping. It's meant for you, built for you, understands your preferences, and that's the experience. You go to Google, you go to Facebook, like a lot of the day-to-day technology and generally how you approach life is becoming very personalized.
Exactly.
As compared to healthcare, where nothing is personalized. You can't get access to your data, seamlessly. You can't even know what your health history has been for last 3, 4, 5 years, 6 years. Just, it's not that easy to engage with. And I think those silos, everyone, from CMS, government, health and human services to general population has been asking to drive that change.
I was going to stop you just for a second and ask you, maybe you can pivot just a little bit on that. And why is it so difficult for healthcare? I mean, you look at, to your point, all these other industries that arguably are just as complicated and challenging as healthcare in terms of its use of technology. Why has it been a challenge for healthcare to be able to become more transparent, more interoperable, focus more on the patient experience? What's some of the drivers that limits our ability to adopt these technologies or even just processes in general to really transform this industry?
Yeah, that's a great question. I think, Chris, it's not really a technology problem in healthcare. The technology is there. I mean, you're seeing that tech everywhere else.
Right.
Why can't it be implemented in healthcare? I think it's the compliance and regulatory side of just the industry is because you're dealing with PHI. It's very regulated. And then healthcare was the way it has been built over like hundreds of years is very administrative focused as opposed to consumer focused. Right. So a lot of that power and a lot of that transformational change today sits in health systems, large health systems, insurance companies, government, and healthcare only, in the last 2 to 3 decades has now been like moving over to, really person or consumer based.
Sure.
So I really think it's the regulatory and the compliance side of how healthcare has been designed so far, which limits it to really adopt a lot of technologies at scale.
Yeah, exactly. What they call kind of those political determinants of health. We talk a lot about social determinants, but it's also policies and regulations that in some cases has inhibited our ability to improve the delivery model. Also, I think, just as my own 2 cents on it is, we in the traditional model, we focus so much on delivering episodic care, right, in the past, and mitigating risk versus really trying to figure out how to be more proactive in the delivery of care and keeping people well. And I think it wasn't until probably the past decade or so that, healthcare started, asking that question. Why aren't we focusing in on making sure we keep people out of the 4 walls of the hospital versus trying to find better, faster, more interesting ways to treat patients when they are ill. And
That's right.
right. And now that health plans see the real value in that because of capitation, there's a real business driver now for health plans to find methods to encourage wellness and proactive care.
That's right. That's right. And a lot of that, as going back to your question, Clever Care is really championing that, the preventative aspect of medicine and healthcare. So what we are building in Clever Care is pretty unique. So we are a health insurance company built for seniors who have engaged in Medicare Advantage health plans
Mm-hmm.
or Medicare Advantage. And we are really, really focused on providing care to folks who cannot engage in their healthcare because of language and cultural disparities.
Exactly.
So there are folks who are first generation, moved to US. I mean, America is the melting pot of the world. I'm a first generation immigrant. So a lot of people who moved from different parts of the world to build a life and contribute to nation building and economy building. Because English is not their first language, it restricts them to then really engage in their healthcare. They don't have physicians who talk in the same language. They don't have
right,
inpatient setting where someone can understand them and talk to them in their language, understands their culture. Their benefit packages are very like Western medicine focused,
mm-hmm.
which is primarily big on reactive and does have a lot of proactive things. But like example, someone came from Vietnam, from
Sure.
Korea, from one of these countries. In the eastern side of the world, preventative is a big thing, right? So they on an ongoing basis use herbs in their day-to-day.
Right. So talk about
say.
that convergence then that's happening now. I know we spoke about this when we were prepping for this episode, this convergence between Eastern medicine and Western medicine, and how you're seeing that start to evolve.
Yeah, and I think that has evolved it's been evolving. You see how yoga has become such mainstream now.
Absolutely.
Yoga comes out of the eastern parts of the world, started out in India, and I know yoga from I was born, and while being raised in India. Sure. Yoga was a regular practiced by my grandparents, by my parents, and so forth. So now Western side of the world has they've really embraced yoga as a way of living, right? There's herbs like turmeric, like everyone knew when pandemic hit. Turmeric is sort of that golden herb that helps you increase your immunity. So there are a lot of things in Eastern medicine which is practiced day to day over on the Eastern hemisphere of the universe or of the world, and now is being slowly brought in to the Western side. And same thing, there's quite a bit of advancement like immunotherapy, like a lot of different things which is going on in the Western side of the world, cancer cure, genomics, which is now going on the Eastern side of the world. So I think the world is coming together, and healthcare is no different, and that's how it's converging.
Exactly. I mean, just things like meditation, for example. You mentioned yoga and some of the just physical attributes of that, but also the mental components of psychological components associated with improving your health and well-being by meditation, using yoga techniques and just other Eastern practices as well. I think you're starting to see become mainstream here in the West as well too.
That's right. That's right. And that's what we are banking on. I think at Clever, what we are doing is we are building our benefit packages for our seniors, where they can interact with their care in their language, with care providers who really understand their language, their culture. And the benefit packages, we have things like herbal medication, like you practice Tai Chi. We have unlimited acupuncture that we are providing in our benefit packages. So all of these are sort of the gold standards of Eastern medicine, which we have amalgamated with the traditional Western medicine benefits. And this really drives a more proactive engagement of our senior population in their care, which helps us, better manage the whole quadruple goal. I mean, We are not, our healthcare costs are low. Our members are not using inpatient settings as much as, they're not frequent flyers. I mean,
Sure.
we always have some exceptions, but really having this amalgamated view of driving engagement and the benefit packages is really helping us with driving proactive healthcare as opposed to reactive and sick care. And you call it health equity, which we are trying to solve for. You call it, building a new way of providing care and medicine, which is more individualized. We are trying to do that in our own way.
That's right. I mean, much more holistic approach, mind, body, and spirit as well too.
Exactly.
Which is now we're here in the West. We're starting to realize the real value of that. Let me pivot just a little bit, and since your background and the things you've been doing in the industry of being driven from a technological standpoint, you look at the adoption of electronic health records and some of the tools that have been built into those things, like clinical decision support, that have helped providers keep up with the latest clinical knowledge and help them make better clinical decisions based on evidence-based medicine. Talk to me a little bit about where you see the adoption of AI and machine learning has started to have an impact within the health plan, ecosystem. What are some of the things that these technologies are being applied to improve the delivery of care?
Yeah, no, that's a great question, and that's what I do. So I think from my perspective, the way, and I can talk particularly in view of what we are doing at Clever Care Health Plan. So it all starts with data, Chris, right?
Mm-hmm.
There is no AI without data, having the right data layer built in. So what we are doing is we are building out sort of an ecosystem of tech where we are building a data operating system, which is ingesting data from various different sources: primary care, specialty, hospitals, SNF, LTACs, different vendors, CMS. So everyone we work with, we are ingesting data at scale from all of those places, both structured and unstructured. So we also have built a layer of NLP so that when we ingest unstructured data like SOAP notes or like PDF charts and so forth,
Sure.
we can extract intelligence out of it and contextualize it. And we land it into our data operating system. And all of our data operating system is really built on Amazon Web Services tech stack.
Mm-hmm. Exactly.
This year, we are really, honing in on the business intelligence side of the house. And early next year is when we start getting into artificial intelligence. So I can talk to you about some of the use cases. I mean, if you look at healthcare holistically, has been looked from a clinical perspective only, but
Right.
now we are enriching our data with social and cultural data. We know if our members are, what language they speak, what culture do they come from, which geography do they live in, what is the disease prevalence in that geography, how many community centers are there in that geography, how many PCPs speak their language. So we are looking at these individualized cultural, language, and social data elements and integrating that back into our data and enriching our data sets to make it ripe for AI. Right. And then from an AI perspective, we are solving multiple things. So obviously, big part of this is ingesting and making sense of unstructured data. So we are using Amazon's NLP technology, which is Amazon TextRact and SageMaker to do a lot of that. We are next year, we will start building our deep learning models around dynamic risk stratification, which not just we will be dynamically risk stratifying our population, not just from a clinical perspective. Clinical engine we already have.
Sure.
Now we will be adding language and culture to that.
Right.
We will be doing disease progression engines. We are looking at our physicians, right? How likely are physicians engaging? So we have our physician engagement scoring that we are building. So there's multiple different use cases that we are building, which will really enable us as a plan to better understand the patients or the members we serve and the physicians we partner with in order to provide care.
Exactly. Yeah, and then how are you partnering them with the provider community? I mean, to your point, data is the today's currency. It provides information and insights that hopefully help us make better business and clinical decisions. How is your organization then partnering with then the providers themselves to take that data, leverage it in a way that drives this new model of care, moving again away from this episodic level of care to more proactive and preventative medicine?
Sure. No, that's a great question. Our fundamental really, Chris, is we will meet the providers where they're at in
Mm-hmm.
their journey or where they're at in terms of their tech stack. So there are some, larger groups we work with who are very tech savvy. For them, we are working on making our data available as API driven. We'll have Fire 4.0
Right.
APIs that they can ingest directly into their EMR plugs and present this data for our particular membership that is, attributed to them directly within their patient charts, right? Versus
Exactly.
some who are not that tech savvy, where we are sending them like daily, weekly, monthly feeds of data of things like, historical data, suspect data, and ADT feeds and things like that. We are partnering with them to provide it, in the form whatever they can ingest. And then the third one is we are also, and I think this will be sometime like later half next year, is where we are working towards building out like smart on fire FHIR APIs,
Right.
which the provider groups can directly work with, and we can work to help integrate that back into their EMRs. So it is seamless within their workflows, and they don't have to go to other portals. So there's a lot of things. I mean, in short, there's a lot of different ways we are working with the providers and building our tech to engage more deeply with provider workflows, so they don't have to look for another system to go do something with Clever Care.
Yeah, that makes perfect sense. And then I'm assuming also that you're developing this as a platform with these open APIs that then allows other companies to develop technologies that might be able to leverage the data that's coming out of your systems as well to support other parts of the healthcare ecosystem.
That's right. That's
Mhm.
right. Yeah. So we are building an open ecosystem. Again, we are a health insurance company. We are not a tech company, but we are making sure that we enable each and every aspect of what we do with technology and digitally enabled workflows to make our own lives easy, our providers' lives easy, better engage with the members, better engage with the brokers who are helping us, align with the members who need our care, and so forth.
No, absolutely. Now, if you could think of, one or two, three things that you would like to see happen faster, more expeditiously to really start to transform this industry, what would be some of those things? And then, what do you see fast forward 5 years from now? How do you envision healthcare operating? How do you envision a health plan, I should say, more operating in partnership with the provider community?
That's a very power-packed question,
I
Chris. I'll
know.
try to
It's a
answer
lot.
it best I can. So,
Exactly.
one of the reasons I came to work for insurance company is a personal incident. My daughter fell and she got a cut on her eyebrow, and we called 911, went to the hospital. Didn't realize the hospital was in our network. Didn't realize the guy who's doing the suture that specialist is not part of that network, even though the specialist was within the hospital.
Right.
And then we had to get the stitches off in sort of a nearby pediatric facility. And then when I started receiving the bills, I went like literally 2 months back, and even though I've been in healthcare 15 years,
Sure.
kept going back and forth on, hey, I didn't know that. Like, I didn't know the network, the hospital is in the network, but the doctor who's doing the work is not. So things like this is not for regular people. I think for me personally, price transparency is going to be a huge factor. That's why, like, that drives me. Like, healthcare should not be opaque and black boxed. So I
Exactly.
think transparency on the price will help consumers make better healthcare decisions. And I think for me, that's going to be huge. Interoperability is mandating, the government is mandating it. I really feel it should be mandatory. No one should hold patients' data or members' data, and the data should be widely shared with the members and whoever the member wants to share the data with. So I think interoperability is becoming mainstream, but it will just be table stakes, or it is
Exactly.
table stakes now. It just needs to be implemented.
Right.
Next 5 years, I personally am very hopeful that this whole wearables IoT will become more mainstream, where there's a continuous flow of vital and other types of data into the healthcare system.
I agree.
And there is triaging mechanisms which will help providers really intervene as and when needed. The other one is there's a movement going on in the country to take healthcare from volume-based care or fee-for-service care to value-based care, which is outcomes related. So I think that this thing is only going to grow across the spectrum, across the country. I really feel genomics will be more democratized from a cost perspective, right? If genomics is democratized, you can pretty much proactively eliminate a lot of different diseases which come by doing gene mutations and stuff like that. I don't know if that is really next 5 years, but perhaps next 10 years. Manufacturing antibodies is going to be very normal. So I just feel like there's so much going on in healthcare, in pharma, in just across the biotechnology that it's all going to become proactive is the word. That's going to become more.
And no, I completely agree. I mean, you see the adoption of these remote patient monitoring platforms and organizations moving to more chronic care management strategies. Definitely moving to more value-based care is really the vision I think the industry has, and it's creeping along and trying to get down that path. I think as you start to see more and more of the baby boomers move into their senior years and them wanting to remain independent, as well as, they demand, quality care. I think to your point, you're going to see these technologies become mainstream. Most of the healthcare will probably be delivered outside of the four walls of the hospital into either ambulatory settings or, quite honestly, in the patient's home. So this whole concept of patient-driven healthcare at home is going to be not just a wish, but really the status quo going forward as well. Let me, it's the time is flying as I knew it would. We've got probably another 5 minutes or so here on this episode. I wanted to just get your insights as a, industry professional who's been in this industry for a little while and has started seeing all the transformation that has happened and that you're seeing happen and will continue to happen over the future. What advice would you give a young professional now that's interested in going into this industry in terms of the things they should focus on, whether it's academics or career path? Where do you see the greatest need will be, and what do you think a young professional that's really trying to figure out how to navigate this industry, what advice would you give them?
Well, healthcare, I think, is a place where there's so much need and there are so many problems to be solved, which I think for the younger, so if you're going into engineering, if you're going into medicine, if you're working to become a doctor, even if you're not working to become a doctor, physician assistant, medical assistant, nurse practitioners, registered nurse, LVN, LPN. So there's healthcare there's just such a grave need on all sides that there will always be opportunity in this field. And the only message is there's a different high you get, when you see all the work you do, how it impacts the people on a day-to-day basis. And I think for the younger generation, healthcare really, I think you'll get that out of your careers, because it doesn't matter if you're a technologist, if you're a software engineer, if you're a nurse, if you're indirectly related to healthcare, anything you do impacts people's lives. And there's a lot of I think there's that emotional connect you'll get with your career, which a lot of times, you go into other careers and it becomes a little bit mundane. So I would highly suggest pursue career and try to get into healthcare. And then there's also over the due course of time, this is one industry which is recession proof. In a sense, people will always need healthcare.
That's right.
And you will always have jobs, no matter what.
Exactly.
And if you are an entrepreneur looking to build something, there's no better place than healthcare, because there are so many problems that need to be resolved. So my only message is hey, pursue it. anything you do, healthcare is a place which has space for all. If you have any questions, reach out to me on LinkedIn, connect to me on LinkedIn, and I'm very happy to give back and just give my 2 cents to people who are trying to get into healthcare or technology in general.
No, I think that's great advice. One of the things I used to share with our senior leadership when I was a CIO is that, every business and clinical decision that's made in this hospital has an IT component built into it in some form or fashion. And so the leadership, staff, clinicians, everyone needs to understand how technology is impacting their role in the organization and to embrace it and be a part of the change to adopt these solutions going forward. Because technology, unless something happens, a meteor hits the earth and, we sets us back, 2 millennium, technology is here to stay. And how you apply that technology and leverage that technology will ultimately determine to some degree the success that you have, in your field of choice. And so if you're not comfortable with technology today, I encourage you to start getting comfortable with it, whether you're doing your profession or you've been there for 25, 30 years. This is a part of how we do business today. And so embrace it and learn how to leverage it going forward. So we're about to wrap up this session. I just want to see if you had any final thoughts, Unmesh, in terms of, your career, just, anything about the industry that we haven't had a chance to talk to. Happy to have you back if you want to delve into some further discussions in some of the areas, especially I'm interested in the Eastern and Western medicine convergence, even and digging into that a little bit further in the future as well, too. But just want to give you a few more minutes here before we wrap up to share anything about what's happening at, Clever Care Health Plans, or just in general, what your feelings are about what's happening in the industry.
Well, I think this was quite power-packed discussion for the 30 minutes, Chris. I think we covered a lot of ground.
Yes.
My only closing comments will be anyone who wants to get into healthcare, there's a need. You want to reach out to me, please do on LinkedIn. Chris, I want to thank you for taking all this work that all of these, all of us working in healthcare, we usually are working behind the curtains and building all these things, and we never get a chance to put our voices out. So thank you for being our voice and taking this out to people to really know what's going on. And I personally am very excited for Clever Care. So if anyone listening to your podcast, if you are in California, because that's the first market we are working in, if you have seniors in your home who are enrolled in Medicare Advantage or will be enrolled in Medicare Advantage and do not speak in English as their first language, or even speak in English in their, as their first language, but really want to get the benefits of Eastern medicine within their benefit packages that they receive, please come to Clever Care. We will be very happy to take the membership and really get a chance to service your family members. And yeah, it was a pleasure discussing an array of things today in this podcast. And I'll be very excited and happy to get, if we have any future opportunity, Chris, would love to discuss more about Eastern Western medicine technology, anything you want to talk about.
Well, that's it. That's a wrap. Another, what I believe is thought-provoking episode of Straight Outta Health IT is in the books. Thank Unmesh for taking time out of your busy schedule to share your insights on the state of our industry and the things you're doing to help transform it. Keep challenging us to look at ourselves in the mirror and ask ourselves, what we can do to be a positive impact on this industry and drive change and improve the condition for our fellow man. As always, your feedback and support is always welcome and appreciated. Let's make this episode go viral. Take care. Look forward to seeing you on future episodes, and God bless.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.